Hey everyone, and welcome back for another deep dive with us. This time, we're taking a closer look at residential rehab. It's a topic many people have questions about, so we're here to break it all down.
You're right. It's a big decision for anyone considering it.
Absolutely. Whether it's for yourself or someone you care about, understanding residential rehab can be a game changer. We'll unpack what it is, what really happens when you choose that path, and how to figure out if it's the right fit.
It's about getting that clear picture.
Exactly. So imagine this. You hit the pause button on life work, stress, everything, and you dedicate yourself entirely to recovery. That's residential rehab at its core.
It's about creating that space entirely dedicated to healing and growth.
It's like pressing pause on the world and finally having the chance to just breathe.
Precisely. You're living at the facility, getting 24/7 care, medical attention, therapy, constant support, the works. It's all designed to help you focus on you.
Okay, so full immersion in recovery. When we talk about residential rehab, is there like a typical time frame people are looking at?
Well, programs are really tailored to each person's needs, but you usually see lengths of 30, 60, or 90 days. It's not one size fits all, but those are common starting points.
So it's about finding the right fit for the journey. Now, I've heard the words inpatient and residential used kind of interchangeably. Are they the same thing, or is there a difference I should be aware of?
It's a good question, and you're right, they do get used interchangeably sometimes. Both offer round-the-clock care, but there is a key difference.
Yeah.
Inpatient rehab is more medically focused. Think of someone going through severe withdrawal. They need immediate medical help, right?
Right, that makes sense.
Inpatient is more like that, more like a hospital within rehab, if you will.
Okay, so it's about addressing those really intense medical needs right away.
Exactly. Residential, though, while it still has 24/7 support, it's more about the therapy, building healthier habits. It's less clinical.
So less about immediate medical crisis, more about addressing like the behaviors and the thought patterns behind addiction.
Exactly. You got it.
So, okay, so let's say someone's trying to decide between inpatient and residential. What should they be thinking about? What questions should they be asking?
Well, there are a few things, but insurance coverage is a big one. Not all plans cover both equally.
So you got to do your research.
Absolutely. Another thing is co-occurring disorders.
Right.
Like if someone's dealing with addiction and depression at the same time, residential often tackles both together.
Makes sense. Treat the whole person.
Right. And of course, their overall health matters. If there are medical conditions that need constant attention, inpatient might be more appropriate.
And last but not least, how ready someone is for treatment, right?
Huge factor. Residential is immersive, so it takes a certain level of commitment to really dive in.
Like, are you dipping your toes in the water or jumping in head first?
Exactly. And that makes a big difference.
So you're in this safe space, really starting to unpack things. What comes next?
That's where therapy really takes center stage. You'll have individual sessions and group sessions.
And those are designed to.
Help you understand what's at the root of the addiction, what are your triggers, your thought patterns, all of that. You develop coping mechanisms to deal with the cravings too.
It's like having a guide to navigate your own mind.
Right. Exactly. Individual therapy is that personalized attention, figuring out your specific experiences. Then group therapy is when you realize, hey, I'm not alone in this.
That's got to be powerful, that shared experience.
It is. Addiction thrives on isolation, so breaking that down is huge. And in group therapy, you get support from people who've walked a mile in your shoes.
Now, when it comes to the therapy itself, are there different types? Or is it more like a standard approach?
That's a great question because it highlights how treatment should work. It's got to be personalized. Addiction looks different for everyone, so recovery does too.
Makes sense finding what clicks for you.
Right? One you might find helpful is cognitive behavioral therapy, CBT for short. It's about recognizing negative thought patterns that fuel the addiction.
So changing the way you react to those thoughts.
You got it. You learn to break free from those patterns, make healthier choices.
Taking control back.
Exactly. Another one is dialectical behavior therapy, or DBT. It combines CBT with mindfulness. Really good for handling strong emotions, which is key with cravings.
That's got to be tough, riding those emotional waves.
It can be. But DBT gives you the tools to manage it, find that balance. Then there's motivational interviewing, or MI. This one focuses on your own desire for change.
So less about being told what to do, more about figuring out your why.
Precisely. You're guided to uncover your own reasons for wanting to recover, your values. It's very empowering.
Now, we can't talk about addiction without talking about trauma. A lot of times they go hand in hand. Is that something addressed in residential rehab?
Absolutely. Lots of programs incorporate trauma-informed care now. They recognize that past trauma can be a huge factor in addiction.
Makes sense, trying to numb the pain.
Right. Trauma-informed therapy focuses on creating that safe space to work through those experiences, understand how they impact you today.
So it's about healing those deeper wounds.
Exactly. It's a key part of the whole recovery journey.
This is all incredibly insightful. It seems like finding the right program, the right approach, it's all really crucial.
You're absolutely right. And a big part of that is considering how long the program lasts. You've got shorter term programs, and then there are longer term options too.
What's the typical time frame for a shorter program?
They usually run about 30 to 90 days. It's more condensed, more intensive, but it helps people stabilize, develop those coping mechanisms, really build a base for recovery.
Like a jumpstart on sobriety.
That's a good way to put it. And often they'll transition into outpatient therapy after or support groups to keep that support going.
So it's not like you're just thrown back into the world without a safety net.
Right. Now, longer term programs, those are usually 6 months to a year, sometimes even longer. Those are more immersive, allowing people to dig deeper into what's driving their addiction.
So for people who need more time, more intensive support.
Exactly. They often use something called the therapeutic community model, or TC. It emphasizes personal responsibility, community living, life skills, that sort of thing.
But yeah, that's an interesting concept. How does that work?
Sure. The TC model recognizes that recovery isn't just about stopping the substance use. It's about changing your whole lifestyle, the behaviors, the thought patterns, everything.
Complete transformation.
Right. So in a TC, everyone lives together, shares responsibilities, supports each other, holds each other accountable. They do therapy, group meetings, activities to learn those life skills they'll need outside.
Like a microcosm of the real world, but in a safe environment.
That's a great way to describe it. They learn to communicate effectively, resolve conflicts, manage their emotions, all those things that are crucial for staying sober long term.
Equipping them for life after rehab.
Exactly. TC understands that true recovery, lasting recovery, it's about more than just not using. It's about creating a life worth living.
Building a foundation for a better future.
That's it. But here's the thing. Finishing a program, no matter how long it is, it's not the end. It's more like the beginning.
Okay, so then what happens? You walk out those doors. How do you stay on track? After all that progress, how do you not fall back into old habits?
That's where Aftercare comes in. It's all about the support system you build to maintain those gains you work so hard for. Think of it as the bridge from rehab back to your life.
That transition can be tough, I'd imagine.
It can be, so aftercare is crucial. It can take different forms depending on the person, but one option is sober living homes. These are drug-free environments where people can continue their recovery while easing back into everyday life.
So a stepping stone between rehab and being fully on your own.
Exactly. Structure, accountability, support from peers, it's all there.
That community seems to be so important throughout this whole process.
It really is, and that's where support groups come in too. AA, NA, things like that. They provide that ongoing support network.
That sense of community, knowing you're not alone, it's got to make a difference.
It does. It really does. And there's also relapse prevention planning, working with therapists to develop strategies for when those triggers pop up, when cravings hit, how to handle setbacks without going off the rails.
So you're prepared, not caught off guard.
Exactly. It's not about living in fear of relapse. It's about having a plan, knowing how to cope.
Being proactive.
Yes. And we can't forget about therapy after rehab, or medication if that's appropriate. Sometimes continued therapy is key to navigating life's ups and downs. And medication can help manage cravings, reduce those relapse risks, or address other mental health needs.
It's all about having that toolbox of resources, right?
Absolutely, because everyone's recovery is different. What works for one person might not work for another.
So you work with your doctors, therapists, support system, you build that plan together.
That's the key. Now, we've focused on residential rehab, but it's important to remember there's also outpatient treatment. It's another path to recovery. So how do you know which one's right for you?
That's the million-dollar question for a lot of people, I'm sure.
It is, and honestly, it depends. Residential provides that structure, that 24/7 support. It's immersive.
No.
It can be life-changing for someone who needs to get away from triggers or who needs that intensive help early on.
So if you need that separation, that extra layer of support, residential might be the way to go.
Right. Outpatient, though, it offers more flexibility. You go to therapy, you do the work, but then you go home. Good for people who can't just put their lives on hold, work, family, all that.
It's about finding that balance.
Exactly. And of course, cost is a factor too. Residential, even with insurance, it's an investment. Outpatient tends to be more affordable.
Makes sense. Got to be realistic about what you can manage.
For sure. Your home environment matters too. Outpatient can be really effective if you've got a stable, supportive home life. But if it's chaotic, if there are triggers everywhere, residential offers that safe haven.
It's about being honest about your environment, what you can handle.
Absolutely. And finally, how severe is the addiction? Residential with that 24/7 support, it's often best for more severe addictions, people who've struggled to stay sober in the past.
Matching the level of care to the level of need.
Precisely. Some people do great with outpatient. Others need that immersive residential experience to really break free.
It all comes back to finding the right fit for you.
You got it. The biggest thing is don't be afraid to reach out for help no matter what path you choose. You deserve support. Taking that first step is huge.
Couldn't agree more. Well, we've covered a lot in this deep dive into residential rehab. Different aspects, different approaches, the importance of aftercare, and how to know if it's the right choice for you.
We've talked about how recovery isn't one size fits all. It's about finding what works for you, your life, your goals.
And just to reiterate, this was about giving you information, not medical advice. It's about empowering you to have those conversations with professionals who can guide you.
Exactly. Keep learning, keep asking questions, keep advocating for yourself.
To everyone out there facing addiction, you're not alone. With the right support, the right information, and self-compassion, recovery is possible.
It is. Remember, it's a journey, not a race. Every step towards healing is a victory.
That's a powerful message. Thank you so much for joining us for this deep dive. Keep those questions coming. And until next time, remember, knowledge is power.
See you next time.